This is the Epoch Times.
Welcome to Epoch Audio, showcasing the best journalism covering news, culture, and society, addressing issues overlooked or avoided by other media. For the text version of this and more articles providing truth, tradition, and hope, please go to theepochtimes.com.
At least 602 Canadian girls under 18 have had breasts removed or reduced in the last 5 years. By Marnie Cathcart. More than 600 female youth under the age of 18 have had their breasts either fully removed or reduced in Canada since 2018, according to new data provided by the Canadian Institute for Health Information, CIHI, and compiled for National Post. The CIHI documented hospitalizations and day surgery visits for bilateral mastectomies as part of gender reassignment surgery, with 536 in 2018 to 19 and rising to 985 in 2022 to 23. A total of 4,071 visits were recorded for mastectomies or breast reductions by transgender individuals, and of those, 602 were carried out on children under the age of 18. The youngest child documented was 14, and 303 of those procedures were performed in teenagers aged 17 and younger. The data from CIHC did not include hospitals in Quebec or private clinics. A specialist in transgender health told Post Media that 50 to 70% of youth who apply for funding from the Ontario government for gender surgeries choose a private clinic in Mississauga, so the number of young women having mastectomies could be significantly higher. Some provinces provide public coverage for these surgeries, but not the additional cosmetic procedures to fine-tune after the mastectomies, for example, liposuction or contouring to appear more masculine. The CIHI data indicate there were 536 hospital procedures involving mastectomies for transgender individuals in 2018 to 19, and 14% of those 76 were performed on youth under the age of 18. Most are performed under general anesthesia through day surgery. In 2022, surgical backlogs drove those numbers down, but private clinics reportedly continued to take patients. One doctor told Post Media that the private clinics don't want to share their numbers. Private clinics just keep churning them through, said the doctor, speaking anonymously. The fact that you can't get the numbers from private clinics, it's very cloak-and-dagger. They're still billing OHIP, Ontario Health Insurance Plan. That's tax dollars. That should be publicly accessible information. We need to see these numbers and ask questions, the doctor added. For several months, Canadian parents and members of the community have been taking part in protests about gender ideology in schools, putting a spotlight on the rise in youth who are identifying with gender dysphoria. Some European countries have moved to restrict irreversible gender surgeries to adults over the age of 19. However, Canadian surgeons are performing breast removals on girls as young as 14. The CIHI numbers indicate. CIHI did not immediately respond for requests for information. A new report published October 1st in the Plastic Reconstructive Surgery Journal titled Gender-Affirming Surgery in Adults and Young Adults, a Review of Ethical and Surgical Considerations, said the number of transgender teens asking for gender-affirming surgery is increasing. The report said that caring for transgender adolescent patients brought up important ethical, legal, and technical considerations that must be addressed by the clinical team, especially as the population of youth seeking surgeries after puberty-blocking drugs is increasing. Future research is needed describing functional and psychosocial outcomes in these individuals, said the researchers.
Thanks again for listening to Epoch Audio.
For more Epoch Times articles in text, please visit theepochtimes.com.
This is the Epoch Times.